Once again, ladies and gentlemen, welcome to the Speakers Inc. We Speak Global Speakers Showcase Series. My name is Dwayne, and today it is a huge pleasure to introduce a lady, a doctor, who is all about mental health, mental wellness in the workplace in particular. Her name is Dr. Samke Ngcobo. She's an author, doctor, and philanthropist who is passionate about mental health, advocacy, and holistic wellness. You're about to find out just what she's about. And if you would like to find out more, please stay in, because we are going to be asking a couple of questions as well. Find out more about the doctor and how she sees what she does can help what you do in the workplace. Ladies and gentlemen, please welcome Dr. Samke Ngcobo.
What does a mentally ill person look like? It certainly is not somebody running around on the streets. It's not somebody only who speaks to themselves. I'm here standing as somebody who is a medical doctor who lives with a mental illness. This is a stigmatized mental illness, and many people do not understand. I'm also a patient who is a doctor, and that is something that people struggle to accept. I have decided to use my journey as a statement against stigma, a statement against prejudice, and a statement against discrimination of people like me. You see, I have lived with bipolar disorder for the past 21 years. This makes this journey since the age of 14 years old, and is twice the duration of my medical degree. My medical degree is 11 years old, and my illness is twice that time. I do not feel inferior to my colleagues by virtue of me having a mental illness, and I don't feel superior to my fellow mental health care users by virtue of having this illness. I actually have an advantage of sitting on either side of the table as a medical doctor who gets to engage with people living with my journey, and also as a patient. This is an advantage as it enables me to be a better doctor, as I have empathy, compassion, and an understanding of the lived experience of people living with a mental illness. As a patient, I'm well aware of my rights, and with that, it enables me to walk this journey with confidence and conviction. One of the things that people don't realize or take for granted is the degree of stigma that one is exposed to. There are various kinds of stigma: religious stigma, cultural stigma, social stigma, and the worst one yet, self-stigma. I have had to overcome these various kinds of stigma to be who I am today. From a social perspective, I have been avoided. People have not wanted to eat from where I eat by virtue of the fact that I had a mental illness which they felt was contagious. From a religious perspective, I was deemed to be demon-possessed, and people then avoided me. From a cultural perspective, I was deemed to be bewitched, and at times deemed to be the witch. I say I've had the worst stigma when it comes to self-stigma because of the fact that with self-stigma, one feels like you are a pungent odor towards other people. It's something that follows you like a dark cloud, unlike the other forms of stigma, which you can sort of deal with once you've accepted yourself. When I accepted myself and overcame the shame of my illness, that is when I was not too concerned about other forms of stigma. I call stigma the unexplained sin, the uncommitted sin, for the fact that one has not done anything wrong to be subjected to this, but nonetheless, one is exposed to it. I have a story of a little girl who was 14 years old. This young lady found herself to be hearing things that other people couldn't hear. For the fact that she felt that she could hear everything and could hear things that people couldn't hear, she felt invincible and had special powers. This young lady could listen to the radio and feel that the radio was communicating with her. When she saw billboards, she felt that they were speaking directly to her. Not the same as reading an advert that is relevant to you, but feeling that the conversation was literally directed at them. Her behavior worsened with time when the family started to notice that she felt that she could communicate with deceased relatives. She felt that the deceased relatives would want to harm the family and were also communicating. Sure to form, this girl's parents took her to the first mental health care services at that age of 14. This little girl is me. 21 years ago, I became exposed to mental health care services in a facility that was still premature and immature in dealing with this kind of problem. When I came to the hospital, I was so aggressive that I had to be tied down to my bed. I recall a time that is so clear in my mind when people from the church community came to see me. In coming there, they made me shout the name of God. The first time, I said it and complied. The second time, they asked me to say it louder, and I complied with the big people. The third time, they made me shout and scream in the ward. I had to scream the name of God. It is in hindsight that I realized that I was being exposed to what the other people call an exorcism. They felt that they were removing something from within me in order to give me a purity of heart and a purity of mind, because I was deemed to be somebody who was demon possessed. Soon after that, I wanted nothing to do with this God. How can God bring a demon into a little girl? How was I the weakest link? For this reason, I had very averse relationship towards religion. As I walk and navigate this journey, it's been 16 years of learning to accept it. One of the darkest periods was entering medical school. You see, when I finished matric, I performed very well. For the first 3 years, I continued to perform well until my illness reared its ugly head. When my illness appeared, people did not understand. Why was I not accepting this journey? You see, people judged me for the weight gain, where I gained 30 kilograms due to the medication. This discouraged me from wanting to continue because it was making me deformed from the appearance that I had. I gained 30 kilograms from the weight of 57 kilograms and increased to a whopping 87 kilograms in a space of 3 months. This shame made me very uncomfortable and made me stop my medication, as I did not understand what the benefit was. My journey continued in a journey of unacceptance and lack of insight towards my illness. I would throw away the medication, pretend to swallow it. I did every trick in the book. Hence, patients can't escape me when I see that they're doing the same thing as I am. Eventually, I managed to finish medical school, but this was not in record time, as one can imagine, because once a year I'd be in hospital for 2 weeks, twice a year at times. Our rotations for each discipline would be 6 weeks at a time. I would be sick for the 3 weeks and recuperate for another 2 weeks. This meant I was losing things related to my academic life. Fast forward to 2017. This was my journey and turning point, where I finally accepted this 21-year-old journey. It took 16 years to get to a place of accepting my path in life. I learned to befriend my illness. Bipolar disorder is a difficult illness to live with, but I learned to embrace my mental illness in the hope of encouraging other people. What was different in 2017, you may ask? So this journey 5 years ago began when a multidisciplinary team came and approached me. I was seen by psychiatrists, psychologists, occupational therapists, the nursing staff, and they helped me to understand what this journey meant. I have never looked back since that time. As I continued with my journey with my mental illness, I can't say that it's been smooth at all. In 2020, which was 2 years ago, I had something that reckoned with me and transformed my life forever and brought the Samke that people see today. 2 years ago, I had a public psychotic episode, basically a mental breakdown, in full view of colleagues, in full view of other friends, and people I didn't know. You see, this is the danger of social media at times. In my state of unwellness, I left several voice notes saying things that did not make sense, things that people made them fear me, and things that completely confused other people. Sure to form, I was sent to hospital again, amongst the many other times. But this time, it was different. I had always enjoyed the luxury of private health care up until the point when I had to be in a state facility. This was life-changing. I was taken to hospital the very next day after I'd had the relapse. And I was somebody who struggled to accept the way mentally ill people are treated. It brought to mind the suffering that people don't understand. This is when I reached breaking point and woke up to being an activist towards mental health care in general, and also as an advocate towards mental health. It's been a long and arduous journey. After I was admitted to hospital during that time, I was booked off work for an incapacity leave, which means I was booked off work for 6 months. I'd been booked off work for 3 weeks at a time, sometimes being off for another 5 weeks, but never did I think I would be put off work for 6 months. This threatened who I was. I had always identified as a doctor, and being away from that made me struggle with who I was. I'm thankful for the experience when I look back, because this experience helped birth another person that I did not know, a person who was more confident, a person who was unapologetic about their journey. During this time, I decided to put pen to paper, write my book, start initiatives related to mental health, aiming to demystify and destigmatize this journey. I'm very grateful for this part that I've taken in mental health advocacy, and aim to use many platforms in order to bring an understanding of what this journey looks like. What is it like to live with a mental illness? And hopefully inspire many more people as I navigate this path. I've been somebody who has braved many forms of stigma, and I stand up to be counted to say my medical degree is not just who I am, and so is my illness. It does not define who I am, but I thrive despite it.
We really do appreciate you being with us. And I've got a question for you straight away. What made you embark on this journey? What made you decide, as Samke, to start talking about this to the public in general? What made you start walking this journey?
Thank you for your question. After I had experienced a very public, what people would call a public meltdown or a public relapse, when that happened to me, I realized how I became defined by the illness. And that was sad for me, because I thought I'm so much more than the illness. I'm so much more than the diagnosis. And when people only saw me in a state of unwellness and used that as a way of defining me, I found it to be unfair. And I realized that I'm probably not the only person who starts being seen for their weakness or their fall, or, where you're written off, so to speak, by people around you in society. So I decided to use my journey. I felt a responsibility to use my illness, use my journey and my knowledge as a doctor to show that you can still rise no matter how dark the space you've been in. You can emerge stronger and more resilient through that experience.
I couldn't agree more. And I think it's just such a fantastic thing that you're talking about something that we should all be talking about so much more. It's become such a big issue in society. I do have to ask you, though, have you had very much pushback in terms of people being scared to listen to this, scared to understand almost? Do you ever feel that?
I've been largely very well embraced, and I'm deeply grateful and humbled by that. But I do realize that, within a profession that we're seen as gods of sorts who have everything put together about us as doctors, it has been uncomfortable for some of them to say, why are you going on about this? And I think one of the things that makes me speak up is to say that I don't feel that I'm inferior for sharing the struggle that I have. Actually, I'm much stronger because I have these odds stacked up against me and I still rise above them. So very well embraced, but I mean, it has been uncomfortable for for some people, but largely it's something that I feel that when something is new and not spoken about often, especially from somebody who is supposed to be having it together, because my existence is a breaking of a stigma. How does a mentally ill person look like? How does a person who's mentally unwell look like? So my existence itself breaks a stigma and shatters a stereotype. And obviously there might be a pushback or a resistance to that because it's something that's outside of the norm.
And I suppose scary for the recipient, but I think also scary because maybe they're experiencing the same types of things. So it's very difficult and quite scary to approach those. But I think the message itself must be hugely positive, and you must really feel so rewarded when you are talking to a group of people and you can see those light bulbs going off with people when you are destigmatizing. Is that a very big driver as to why you do what you do?
Absolutely, 100%. That is the driver, to see that light bulb go off for people. And it's a light bulb of hope. It's a light bulb of inspiration. It's a light bulb that says to people, oh, I know somebody in my family or my inner circle that is struggling with this, but here's an example of somebody that is thriving despite their odds. It gives a sense of promise to say that whatever circumstance they may be faced with, someone is an example of having risen above that. And my story is not just of mental health, mental illness, but it's a story of hope and triumph.
Sure. Because it could not have been easy being the doctor that you are, going through this and living with that on a day-to-day basis. That must have been incredibly difficult for you as a human being.
100%. It really has been a difficult journey. And I always make sure and make it a point whenever I speak to my wonderful listeners to say that I may come across put together, but there's nothing glamorous about this journey. I'm very truthful about it, that, I'm not that, oh no, she's that high functioning bipolar as labels come with. When the struggle is there, the struggle is real. And I find it important to highlight that so that people don't feel that she's different to us. No, I come with the struggle, I embrace the struggle, but then beyond that, I am something more than what I come with, which is the illness, along with my other wonderful things that I have to show about myself.
Yes. Well, there's a lot more wonderful to you, I can tell, even just in a couple of minutes of talking to you.
Yes.
My other question would also be, in terms of your day-to-day talks, in terms of doing what you do in front of people, what is the one thing that you really want to leave an audience or an individual with after each of your talks? What's that one thing that you hope lands really well?
One thing that I wish to be remembered by after a talk is for people to feel that whatever they are faced with, it might not be the same challenges I do, but they can overcome triumphantly. You don't just have to emerge crawling out. Yes, you'll crawl, but you can still stand. So I hope after people listening to me and they and connect with me after I speak, I hope they take home messages that I can also deal with what I'm faced with, basically. And not for it to feel distant, but for it to feel doable. From the moment they finish listening to me, they know that, you know what, I can emerge stronger from what I'm faced with. It might not be easy, but even the struggle is a normality. So people to normalize and destigmatize the reality of struggle, and to know that no matter how dark that hole is, you can emerge from it.
And it's so true, because right at the beginning, you said it's a message of hope. And that really is it, right? That hope that one day you could emerge on the other side of this, whatever it is that you're dealing with yourself, emerge on the other side so much more whole as a human being. Yes. Now, in terms of great stories, people must surely come to you a couple of years after you've spoken to a group of people. Somebody might come to you and say, Samke, I have to tell you, this is how my life changed. Do you have any really, really warm stories that you could maybe share with us at this point about something like that that's happened to you?
Oh, absolutely. I have so many stories. There's people who have told me that, they have a better understanding of their loved one after they spoke to me. They may have had, through their struggle with the person's situation that's the same as mine, maybe living with mental illness, they couldn't understand that person's journey. And much as maybe the relationship ended in a divorce or a breakup or estrangement, having to hear my journey through reading my book, through me speaking, it makes them understand that person better and have a level of compassion to that struggle that a person faces. So it's been a remarkable journey of different, people have reached out on all platforms, social media, they inbox me, they DM me, and some people get my number somehow, some way, and they just want to share that sense of saying, you know what, I feel that you are telling my story. They feel like I have walked their journey with them and held their hand through it. So it's always that story of feeling that, they are not alone. Their struggles are not alien, but they are equally human because someone else is narrating what they have been suffering with.
Look, I suppose it's it really is a difficult thing to take on board, that you had to go through all of this so that you could make their journey a little more understandable and easier to go through. But that must give you a serious sense of satisfaction when you know that you are changing the way people think about mental illness as a whole, because you really do. I look at you, Dr. Samke, I look at you now and I think you are put together. There's no way. I battle to equate how that person and this person are the two same people, but because I know a little bit about mental illness myself, I understand where you're coming from. But that must be so rewarding, just to know that I've walked the walk, I'm now talking the talk, and you can benefit from this.
It absolutely does. When people struggle to reconcile the illness with me because they've seen such painful examples, seeing the person in the struggle and it doesn't end well for whatever the reason. So it's a very gratifying, it's very humbling. I'm very grateful for the fact that I've become that symbol of hope and inspiration for many people. And it keeps me going because, as you know,
Yes.
with mental health issues, it's a lifelong ongoing journey. That's the reality.
Every day.
So yes, when I hit those bumps along the way, hearing feedback, that usually the feedback comes at the right time when it's needed. I'm like, oh,
Yes.
did I achieve that? Did I do that? Oh yes, yeah, let me keep going because my story has brought other people forward. So it definitely is very gratifying. I'm very grateful for that.
Well, Dr. Samke, and I am going to say Dr. Samke because you come across to me like a human being that is a doctor in the truest sense of the word, somebody who really does want to see people in the world in a better place, mentally and physically. So that really is wonderful. Thank you so much for your time. Thank you for the message, and thank you for reminding me exactly why I do this for a living, because it's such a powerful tool to be in front of people and to be able to change their life, even for just a moment. So thank you again for your time and for your energy, and like I said, a great message. If indeed you would like to find out more about Dr. Samke, please log on to speakersinc.com. The We Speak series continues. You can find all of that information on the website. Find out how you can make Dr. Samke part of your next event or your next essential moment where you need somebody like this in your environment. The world needs to destigmatize mental health, and Dr. Samke is going to help you do just that. Thank you so much for being with us today. We'll see you all again real soon. Thank you so much.